Hi, everyone. Welcome back to another episode of our Ask a Professional segment. My name is Ryan Abramski, and I went with EasyLiving. We're a home care and care management agency here in the Tampa Bay area, serving the Tri-County area for over 20 years. Every week, we try to do a weekly series about our care management services, but we also have branched out and wanted to reach out to our referral sources and other community partners about what their services are and how that kind of ties back to the senior community. So this week I am joined with Stacey and Ashley from In-Home Senior Fitness. Thank you both for joining today. I really appreciate it. So first, Ashley, tell us a little about you and Stacey and a little bit about your backgrounds and a little bit about In-Home Senior Fitness.
Great. Thank you, Ryan, for having us on today. In-Home Senior Fitness was created actually this month 3 years ago. So we're celebrating 3 years in business this month. And Stacey and I work together. She's a physical therapist assistant, and I'm an occupational therapy assistant. So we were working together in a facility where we had the privilege of doing skilled nursing, acute care, outpatient, and home health. And what we saw were we kept seeing the same patients over and over. You know, they would kind of go through the system. Medicare wasn't allowing them enough home health visits, and they really needed more. But unfortunately, insurance cut them off too soon. So we decided to kind of venture out on our own and start a private pay senior fitness business. So it is considered personal training, but you're getting the expertise of a PT and an OT. So we go into our clients' homes, we work on whatever it is that they need. Some people just, want to work out like you and I would. Some people need, more of like a skilled rehab. Maybe they had an injury or a fall or a stroke. And we are private pay, so it's up to them as, if they want to do 3 days a week or just once a week. It's totally up to them. There's no doctor or insurance dictating what they can do.
Yeah, unfortunately, we see that on our side all the time, is that you definitely know someone needs more care, and then, unfortunately, the insurance or provider is cutting them off. So Stacey, what type of clients do you guys typically see, or who are you guys trying to work with per se?
So we don't have a very typical type client. We have a very wide base. We see anyone from the healthy and fit senior who just wants maybe some general strengthening.
Okay.
To the bedridden client and anyone in between. So we see clients with all sorts of diseases, disorders, complex neurological disorders. We have dementia clients. That's something that Ashley and I have worked extensively with, is neuro and dementia, Alzheimer's. So very good with redirecting and coming up with exercises and activities to not only stimulate their body but their mind as well. Besides just general strengthening, we also prep clients for surgery. So any type of ortho surgery, maybe even heart surgery, is something that a lot of people don't realize that if they can, work with a specialist before they go into surgery, it can actually help their outcomes a lot. And we also work with them after their surgery and rehab, because like we would just discussed, a lot of our clients are cut off of their insurance quickly and they're not done being rehabbed and they want to continue. So we see before, after, maybe Medicare or insurance cut them off, and that's the beauty of our company, is that they choose how often they want to be seen.
Absolutely. And I never even thought about before or after surgery, to get prepped for something like that. So that's definitely that's a great idea. So obviously, me and EasyLiving, working with seniors on a constant basis, we understand the benefits of exercise, especially with our clients. So what can you guys say about what are the benefits of exercise for these seniors?
Yeah, so obviously we all know that physical activity is going to be good for us and helps us to, our life longevity and keep us healthy and strong. I can give you a couple statistics. So
Sure.
Exercise in seniors actually can decrease the risk of Alzheimer's by up to 50%, which is huge. Also, a lot of us know that falls can be the leading cause of death. And so we work a lot with fall prevention and working on balance and strengthening the entire body. Upper body, core, and lower body is necessary to prevent falls. So those are just a couple of the scary statistics, but we can, help to minimize that. So it's awesome.
Absolutely. Yeah. It's, they say if you don't use it, you lose it, I guess is the old adage they always say. So, obviously, I think every business, except for maybe the PPE business, has been affected by COVID-19, and we've really had to, everyone's had to kind of change how they've worked. And obviously, we're doing these calls, socially distancing and making sure we're taking our safety precautions to do these videos. But as you guys, your name is In-Home Senior Fitness, and I'm sure when the pandemic was at its peak, people were a little bit hesitant to probably have people in their homes, just like it affected our home care business and our care management business too. So how did you guys adapt to, that pandemic and branched out from being able to have to go in people's homes? How did you guys adapt to that?
Right. Good question. So we actually have been seeing our patients and clients virtually. So on Zoom, Google Hangouts, Facebook Live, FaceTime, we've been doing virtual sessions, and it's been very effective. We can have them if the client has a caregiver, we can instruct the caregiver on different techniques and things that we want them to be working on. If the client is wheelchair bound or chair bound, we go through a full session sitting in the chair and get a whole body workout. So that's been something that's been great. And also with that, we're able to see clients from all over the U.S. as well, since we're virtual. So we are seeing clients in their homes kind of on a limited, more cautious basis. With that, we are supporting the PPE world with masks, gloves for each client, and socially distancing when appropriate with our clients. And of course, we have always done infection control between our clients with cleaning equipment, whatnot, disinfecting. So we are still doing that, making sure that we're disinfecting everything between clients and reducing the amount of equipment we're bringing in to the homes has been something we've been implementing as well as our standard washing our hands using antibacterial, antiviral, things that we have been doing. So it's going well with the virtual and with seeing our clients, and we're being as safe as possible and taking our part in keeping our clients safe and limiting our exposure to the community as well. Absolutely.
And it's amazing that sometimes during a pandemic, you get creative and you find unique ways, just like you guys mentioned that now you can branch out to anywhere. You're not limited to just in the geographical area. So that's a great thing that was figured out during that tough time. And that's awesome. I'm glad to hear you guys are pushing through and doing good and taking all those precautions. Super important. So,
right.
But I appreciate the both of you coming on today. Super important information, very valuable, especially what we see on our home care side. We understand that making sure our patients are safe and are staying active too. No matter what their limitations are, we know that exercise is super important, even when PT and OT are not there. So we're going to put the contact information for In-Home Senior Fitness down in the information section below. We'll put their phone number, email, and website information. So if you guys are interested, you can always reach out to them. Or as always, you can contact us at EasyLiving by calling our office or visiting our website, www.easylivingfl.com. And again, thank you so much, Stacey and Ashley. I really appreciate you guys joining the call today. Thank you again.
Thank you.
All right. Have a good day, everyone. Thank you so much.